You can use either of these ports, and you just look for the blue arrow. And you just put it in, and it should read the scope right away. It auto focuses and white balances, so you don't have to worry about that. Okay. And then, as you can see, this is very similar to what you're using. What we've been doing is just putting on a stopcock here. All right, and so this is the standard. So up is up, down is down, 210 up, 120 down, 2 LED lights and a camera here, 16.2 French, similar to what you're using, 6.6 French, so any 2mm instrument will go through here. Your bug bees, your biopsy forceps, your graspers, and any Botox needles, your flexible needle. So once you have your stopcock on here, all you have to do is hook your hook your cysto tubing. You can hook it into this side or here. What we were talking about is if you have your interventional cases where you're going to put something through, put your cysto tubing on here, then you can throw your nipple on here and just thread through whatever you need. So they don't have to like move it. And if you're just doing your diagnostic cases, you can hook your cysto tubing here, and this is available if you need to do a barbotage.
So is that a cap on there?
This is just, we'll talk about what stopcocks you guys will get. So most likely you could probably get them through your supply chain for the hospital. So it should be very similar, just probably a different brand.
Yeah, we can use the blue ones we already have. We would just need to individually sterilize them.
Okay, yep. And then, so it's pretty lightweight, easy for them to use. So here, we'll go to the screen, we'll start at the corner here. You can take videos, you can do pictures with video, or just single photos. In this folder here, you'll see it's numbered. And if you wanted to do playback with patients and family.
Can you take pictures from the screen or from this
Not
camera?
from here, only from the screen. Yeah. Not currently available through the handle. You can do playback here for families, and also if they found something remarkable that they wanted to print out, you could get your USB, put that in there, and we'll go back. This eye, by the way, takes you back to the main screen. You'll go into your folders, recent, your recent case. This one, if it's plugged in, will say in progress. Most recent case will be first. Open that up. You can select all if you want all the photos, or you can, if there were some mistakes, you can take those off. And you'll have your USB in. You just hit upload as if you were just like using your iPhone. There's a basic button here, and export will be lit up.
Question, is this individually, like we have to put the name of a patient?
You can do the name here in this folder here when you go into the recent. When you click on that, right here
I see.
is where you can go ahead and put whichever identifier is
Thank you.
suitable for your institution. And then we'll go back. Here you'll see the time limit on your battery. It'll go from green to yellow to red, and then it'll also give you a picture of the scope to plug it in when it gets down to the last 30 minutes. So I tell everyone, keep it plugged in, especially when not in use. If you need to move it room to room, just watch your time there if you're not able to plug it in. But we like to keep it plugged in as much as you can. This also, real quick, if you double tap, it'll make things a little larger for you. And there is up here color, contrast, sharpness, and brightness. If for some reason in a particular room they say they can't see as well, you can just go ahead and tap and change the brightness if you need to. There's an image rotator here, more for ENT products, but if for some reason someone accidentally hits it and you see that it's lit up, you just kind of tap it back.
Question.
Yep.
USB port, is that something that you guys can provide, or that's us?
It would be the physicians would have to have their
Okay.
own, yes. And you can also use encrypted. Some institutions won't let you unless you use their specific USBs or if they're encrypted, so you just have to check in with them on that. And also this, depending, we have this on the IV pole, but if for some reason you could also take it off. You just push these in, and you can set it on a hard surface. If for some
Oh,
reason they
see.
wanted to take it off the unit, you could definitely seat it. You just have to make sure when you put it back on that this is always up. And you can also do it depending on what side you're in. It will right itself, depending. So if you wanted to have these on the other side, you just turn it. Just always make sure that your handle is up. So will we be on this side in this room?
Yes.
Okay.
Yeah.
So we'll just leave that here. Handles
Or
up.
actually, can you put it on the other side? Or, yeah, we've done that.
Yeah, okay.
Thank you.
And then
Question regarding the printing.
yes.
Where would that be attached to?
It would be from the USB. So they would take their USB stick, put it into their computer, and it would print out on their whichever printer is.
Oh, okay.
It's
So
not-
it's not like
No,
that.
for us to hook up to the Olympus, I think, or any other
Oh, okay.
company is very difficult. I don't know that we've been very successful with that. So it would have to be via a USB, and then just real quick to put this back on, there's these three. You want to line up these three with that. Just gonna set it here, and then you'll hear a snap. You
Oh,
want to hear
okay.
that snap so it doesn't fall out. Okay. And then you're ready for your next case.
Sweet.
Any questions? And afterwards, unplug. Everything goes in the garbage, and any alcohol-based cavi wipe to clean. We try to stay away from bleach, just like all of our
Yeah,
equipment.
sponges are great.
Fries it, but if you were to need it for C. diff, wipe it with bleach, then do a cavi wipe right away and kind of clear that bleach off.
Sounds good.
Okay.